Hi, I'm Dr. Johnny, and today for our quick clip, we're doing a Raji's quick clip on the PDO thread jawline. I did a video on the snatch jawline and cheek. We did both because it's better to do the cheek and the jawline at the same time. One of my videos, Parallel Lines of Beauty, I like the angle and the contour of the cheek and the jawline to be parallel, equidistant. Kind of like when people do that selfie and purse the lips, those lines being contoured look the best, and when you fill the cheek or you address the cheek, less needs to be done in the jawline, so it's more cost effective. But today I wanted to just show you the process of a PDO thread being inserted along the jawline, whether you want the snatched look, whether you're a little older and you just want a little tightening, or you just want the sharpest jawline with the most amazing gonial angle at about 110 to 130 degrees. A PDO thread is often a big part of that, and also can lift the edge of the mouth, the oral commissure, so that you don't have that downturn of the mouth. Let's go right to this video in 3 seconds. So remember, if you like the videos, just smash that like button. It helps our YouTube algorithm, helps me produce more videos for you, better content. Subscribe. I'm doing some lives, and I'm also using the community tab to keep you updated, and poll everyone, because a lot of people want different videos done, and I'm like, which one do I pick? And I do a poll, and then it's really helpful because I can see what you guys want to see, and I can produce more content that's relevant. So click the subscribe, and also there's a bell. When you click subscribe, click the little bell, and then you'll be notified of the upcoming videos and all the cool things we have going on. Now, the jawline. Let me walk you through this. Doing jawlines is fun. I often do a V pattern with the PDO threads, and I like a 21 gauge is okay and it's quick, but the 18 gauge barb, and then you can move up to a molded if you want even more lift. So people often ask me, hey, I had a thread, I didn't like it, or I had a thread, I got a problem, or I had a thread, I like it and I want more, or I had a side effect. I don't know what was put in unless I did it. What kind of thread? There's different materials. PDO, polydioxazone, PCL, polycaprolactone, and PLLA are common ones. So understand, a thread's just not a thread, and where you get the thread from, how old it is, how long it takes to get your provider, how long it was sitting on the shelf, determines the tensile strength. The stronger it is, but I don't like permanent ones, the stronger it is, the more pull you're going to get if the barbs and the molds are effective. If they're not grabbing the tissue, I don't care if you had 10 threads, it's still not going to work. So all these nuances are important, so keep that in mind. But let's go to the video I wanted to do and show you what's involved in putting a thread along the jawline. My preference is to go underneath, so here you see it. Now, I put a little lidocaine and epi at the opening. What that does is a couple things. One, of course, pain control, because I use an 18 gauge needle to open it. And also helps with bleeding, because 18 gauge is a larger needle, and the epinephrine in the lidocaine helps stop any bleeding at the entry point. And then I'm inserting the cannula. An 18 gauge is a little harder to insert. It's a bigger cannula. Cannulas are blunt, and the thread goes in. We thread it along the jawline right up until about the midline. Sometimes we have to exert a little bit more pressure, other times it goes. There's a lot of osteocutaneous ligaments and fibrous tissue that we're using. Now I engage the thread. So I pull on the edge of the thread, I pull the tissue towards it, and then at that time I'm engaging it, and I'm moving the tissue so the collagen builds in that lifted manner. I hide the thread behind the gonial angle. I pull with the scissors, we bury it. A very important part of this technique is burying the thread so it's not visible. And then we snip it. Now, we can put another one in. Most commonly, if the jawline is where we're focused and we haven't done the upper base with threads, I'll put 2 in here. It's well tolerated. I did a whole video on I feel my thread, because you can feel sometimes those barbs in there, especially the first 4 to 6 weeks where there's some tensile strength of that thread. So you can also, I have videos on thread problems and the #1 side effect and how to fix a side effect. Those are all good videos to watch. PDO threads are my preference, and they have a great degree of longevity coupled with low side effect profile. They do go away, so it's something you need. Repeat it, but keep in mind, things that are permanent or last forever aren't necessarily the best thing either, because if you have problems or you don't like it, that's a long time. So permanent threads have been taken off the market. These resorb, which is a nice feature of them. And remember, PDO threads are not a facelift. They're not a substitute for surgery. They can delay it. Not everyone needs surgery, not everyone wants surgery, but it works with collagen stimulators, with neuromodulators, with injectable radio frequency, with Kybella. It all works together, because the face, we don't just treat one thing, a brow lift, the upper eyelid, the cheeks, the cordy lines, the jawline, the neck. We treat it all, because no one wants incongruency in their look, an older upper face and a youthful lower face. And as we do the upper face, less needs to be done in the lower face typically. Everyone's different. Everyone's consult's important. Thanks for joining me here. I hope that helped. You got to see what a thread was, what a PDO thread was like injected. Tell me your experience. Have you had them? Were you researching them? Are you scared? Was it a success? Was it a failure? And join me here. Subscribe, hit the like button to keep your skin and body beautiful, healthy, and vibrant.